what would your advice be for practitioners? Let's start with practitioners first of all, about to be more trauma informed. What is your perception of being trauma informed? What does that look like, and how can they embed that into their practice when you know we exist in a system that might be actually flawed and very medicalized?
Yeah. So I think that the sort of term trauma informed has become like a buzzword. And I think that there's a lot of places, a lot of professionals doing so-called trauma informed training, but ultimately it still sits within a medical model. So it sort of, I suppose, in a way, is teaching professionals and practitioners like, this is trauma, this is what it might look like, you know, this is how the body responds to trauma, these are different kinds of traumas and trauma responses.
Yeah.
But if somebody comes to you, send them to their doctor. And it's like, what? You like skip the last bit, and the last bit is it's not an illness and therefore a doctor is not required. So for me, my perspective is true trauma-informed approaches have to be anti-pathology. Otherwise, at some level, you are still pathologizing that person's trauma. So my advice to practitioners, and when I deliver trauma-informed stuff, is that to be truly trauma-informed, you have to get to a point where you're ready to be anti-pathology. Otherwise, really, all you're doing is slapping the trauma-informed buzzword onto and just sort of talking the talk and not walking the walk at all. But the World Health Organization, you know, like for anybody who's watching this conversation between me and you and looking at this, you know, the UN and the World Health Organization published 2 global reports, one last year, one the beginning of this year, around new frameworks that are completely anti-pathology and trauma-informed, and sort of their hopes, I suppose, the UN and the World Health Organization's hopes that we will completely deconstruct psychiatry in the future. And then it came out in 2024, and I was just like, oh my gosh, they've done it. And it's this huge report where they looked at the evidence base, where they found that psychiatric approaches, medical model approaches, eventually they just cause more and more harm. And they looked all across the world at, you know, the frameworks of oppression and discrimination in psychiatry and psychology. I think it's a really bold move, but, you know, there are so many alternatives.